Dr. Hillary. I wanted to talk to you guys about headaches and migraines and how chiropractic can help, among other things that we do at Rangeline Chiropractic. So, the majority of patients that I see with headache and migraine are one of my favorite categories to see because it's an easy fix. And by easy, I don't mean like just one time, but after I've worked on patients and they don't have headaches anymore, I feel like those are these people love me. And I love seeing the results. And we all like quick results. So with headaches and migraines and chiropractic care, you can see the results quicker than maybe shoulder pain, something like that. So let me give you some tips, some things that I see, and some kind of reasons why chiropractic would help in most cases of headaches and migraines. So this is the back of your skull called the occiput. And then this one right here is called C1. The C stands for cervical. The one it's the first one. And then the other name for it is atlas. So this one I find is a huge cause for a lot of my headache and migraine sufferers. So these bones, they move a little bit. And by a little bit, I'm talking like a millimeter. I mean, it's nothing drastic. It's not like an inch movement. And most of the times you can't feel it. I mean, I can barely feel it myself. But I do. So on you guys, I see it on x-rays, and then I also see it on what is called like palpation, meaning I'm feeling how it's moved. And a lot of patients ask me, well, how do you know like what it feels like? Because that's all I've been doing for 15 years is feeling the spine. So my sense of touch and my tactile sense is much greater than the average person. So these bones get misaligned and they pinch the nerves. So on this little plastic bone, it's just this little thing right here, these nerves. There's also this red thing that you see, that's an artery. So it can also constrict like blood flow. So if you don't have enough blood flow, can you imagine why you might have a headache or migraine? If the nerve is pinched, can you imagine why you might have a headache or migraine? Or when you feel like a lot of tension back here in the back of your head all the time, a lot of times these are like jammed up in there. And I tell patients, which I'm sure if you're one of them, I always go, do you have headaches? And then you go, yeah. How did you know? Because the way it's so jammed up in there, like I would be surprised if you didn't have a headache. And so at least once a day, I say that to someone, and you guys might laugh when you hear me say this because you know it's you. I go, do you have headaches right now? Like, I just had one yesterday. How'd you know? It's just the way they're moved. We just know that there's going to cause a problem. So you've got misalignment up here that can cause the headaches and migraines. It can be in other areas of the neck too, but that's just the most common I see. Okay, so when a new patient comes into me for headaches or migraines, I take x-rays because I want to see like what this looks like. So I'm constantly assessing it, feeling it, making sure it's moving and motioning correctly. Other tips for when you can't see me or you can't get to a chiropractor, I found peppermint oil. So when I first tried peppermint oil for a headache, I put it on my temples right through here, just like dabbed it on a little bit. And then sometimes I put it in the back, like on my hairline. I was shocked how well it helped. And it just took it away for a while. It's not like, oh, the peppermint oil like fixed everything. It's not like that. But it does help in the meantime. So if it's like a weekend and you have a headache, I just like dab a little bit on here. Be careful not to get it near your eyes because it's so intense, it will burn. Or if you don't want it on you, you can just smell it. Just smelling it in like that will help. I put it in my diffuser. I have a diffuser everywhere in my house, everywhere in my office. It's just everywhere. So peppermint oil, little trick. And I know that some of you that I've told that to, you're like, wow, I can't believe it works. I agree. I did not think it would work. And then it did. And then I was like, sold on the essential oils. So most things I tell you, it's because I've tried them myself, right? The other thing that I love personally for headaches is CBD oil. So the brand that I use is called Mahalo. The main thing is just to get a good quality CBD oil that's researched, that's organic, that doesn't have like traces of THC in it. But you want the full plant from the hemp plant. So taking this like sublingual, meaning under my tongue, and holding it for 20 seconds, I can get a headache to go away within 15 minutes. Now, granted, if I was at the office working, I would just say, hey, Dr. Grove, can you adjust me real quick? I think I'm getting a headache on, right? And then my staff does the same thing. If they come in like, I've got a headache, I'm like, let's get in there, let's get this out before we start the day, because headaches are awful all day, right? The other thing that I do in the office that my staff love and patients, as I do dry needling, and I stick just really little needles into the back of the hairline, into these muscles that attach on the occipital, like I'll show you right in this, on these occipital areas right through here. I just stick like 3-4 in there, and boom, headache can help go away. I do that a lot with the adjustments. So some of the things that I do are temporarily help, and then the adjustment, meaning like the moving of the bones gently back in place, that's to fix the problem long term. And some patients ask me, well, if it's fixed, then why do I need to keep coming back, right? The problem is that you sleep bad. You sit like this and you look on your phone all day long, or you're on the laptop typing, and then that causes things to shift back out of place. So for long-term correction, we do like a treatment plan. We align these multiple times, and then we work on strengthening the muscles to help this curvature. Pillows. If you sleep on a bad pillow, no wonder why your neck is, bad, and no wonder why you have headaches, right? So we talk about in the office sleeping on a pillow that has like a dip in it. When your head is cradled and it falls back a little bit, that's the natural curve of your neck. And most of us have a neck that's too straight, and it's supposed to be a little curve like this. When it's too straight, your body isn't created to have a giant bowling ball on a little stick. It needs cushion and comfort, and the joints to like sit on each other. It can't be like this all the time, jam, 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 jam. No wonder it goes out of place, right? So we talk about the proper pillow. We talk about stretches and exercises to strengthen again. If you've ever had whiplash, like in a car or roller coaster or anything like that, where it might have torn some muscles and straightened the spine, that it just like sets you up in motion for having neck problems, for having headaches and migraines. So those are other things I can help with. There are a couple types of headaches that I can't help with, and we can quickly discover like what type of headache that is. The x-rays, if they came back and they showed that there's nothing wrong in that, then we might say, hey, maybe there's another cause for headaches. For instance, could it be something that you eat? Are you allergic to something? For instance, with myself, I know that I do better without gluten. I'm not allergic to it, but I have a sensitivity to it, and that will cause more problems in my body. That and sugar. Sugar hates me too. And dairy. Dairy hates me also. So I know that if I choose to eat those, something is probably going to go wrong, right? And then for me, another big key, which I'm sure a lot of you guys think too, is water. I just get so busy all day talking, and then next thing I know, 4 hours have gone by. I haven't drinking any water. I've just been rushing around the office. So I try to put like cups of water, that way I can drink them. But that dehydration, that would be the easiest thing. As soon as you feel like you have a headache, get a lot of water in you. So when my daughter goes, I have a headache, I'm like, how much water did you drink? And it's probably like that much water for the day. I'm like, drink a whole glass of water and then we'll talk, right? Because that can sometimes be like an easy fix. So we've talked about the chiropractic adjustments that I can do to help. We've talked about different therapies at the office that help. We've talked about peppermint oil, CBD oil, the right pillow, stretches and exercises, and then watching your diet. So if you think, I don't think I'm allergic to anything, right? And I would say, maybe you are, maybe you don't know. Like, have you ever tried like a food journal where maybe you write down like what you ate, what time you ate it, and then how you felt after that? I think the easiest thing to eliminate first is dairy. Easy, not really, but it's one of the biggest ones, right? Second biggest, I would go with gluten. And if you guys have any questions about how to do that, just reach out to me. But a food journal, that can help too, and see what you're allergic to. That's just some easy like first steps to do. And you might say like, yeah, I've done that in the past, it never helped. Try again. As you get older, things change. I think it's crazy. So, I don't think I was dairy intolerant until I was like 21. So I know it sucks, but I hope these tips helped. Reach out to me if you have any questions or if you need any further explanations on anything. The main thing is to seek a chiropractor. This is what we're trained in. This is what we do all day, every day, and I'm certain that we can help.